Chicago Med, Season 4, Episode 6, let's go.
Hey, Mr. Lowry.
Dr. Lowry, plastic surgeon.
I can promise you this, I have never started a conversation with another physician by correcting how they address me. Excuse me, it's Dr. Wood, guys, Dr. Wood here. There are much more subtle ways to allude to this, and his way of doing so was a teeny-weensy bit narcissistic.
Excuse me, Dr. Lowry. What's going on?
I became lightheaded during a surgery. Minor procedure too, lipoma removal. Fatty tumor. Stain on the body, had to go. Anyway, I felt myself going limp.
What? A stain on the body? I have never heard that one before.
Anyway, I felt myself going limp before I could remove it. Didn't lose consciousness. Nevertheless, my surgical assistant overreacted. Called 911.
She did the right thing for your safety and your patient's.
I am the patient.
I meant who you were operating on.
Yeah, that's me.
You were operating on yourself?
Of course. I'm not going to settle for anything less than perfection.
You've got to be kidding me. He's doing surgery on himself? This has to be a joke.
Yeah. I'm seeing other scars here. These pectoral implants.
Indeed. Very proud of them.
Liposuction.
Had a 6-pack. Now it's an 8-pack. Filler too. Can't tell, can you?
Everything you've done here looks
Perfect. I told you, I know what I'm doing.
Okay, I think I have an idea of what direction we're going in here. We are seeing the plastic surgeon who likely is also struggling with body dysmorphic disorder, also known as BDD. This is when someone has preoccupation with defects or flaws in their appearance. And in reality, these are usually only slight, or they might even be non-existent to others. But to the person with BDD, they're significant and can cause severe emotional distress. And over 70% of those with BDD seek out cosmetic treatment, most commonly surgical, dental, or dermatologic. And over 60% will receive a surgery. The issue I'm having with this guy, though, is that most people who have BDD are ashamed by their appearance, and they often avoid talking about it to others. In fact, there was a study that looked at 200 individuals with BDD who had surgery, and it was found that only around 3.6% of all treatments resulted in overall improvement in BDD symptoms. And the vast majority of people were dissatisfied with past medical consultations or surgeries.
Even so, your BP's soft, likely hypovolemia from blood loss during the procedure.
I'm well aware I am a doctor, so hang a liter of LR and I'll get out of here.
Actually, I prefer normal saline. Also, let's type in across 2 units of blood to replenish the loss. As for the lipoma, we can finish that up. I'll call plastics for a consult.
No thanks. You do it.
It's best a surgeon handle this.
Disagree. Surgeons don't take advice very well, especially from other surgeons. It's okay. All you have to do is follow my instructions.
Okay, so this guy reeks of narcissism, right? We're seeing a grandiose sense of self-importance, preoccupation with his perfectly sculpted body, a need for excessive admiration, a sense of entitlement, and some arrogant behaviors.
Dr. Charles, I've got a patient for you. Todd Lowry, 43, plastic surgeon. He's been operating on himself a lot. Doesn't think twice about the risks.
Interesting. Doctors, we know best, right? Diagnosing ourselves, writing our own scripts. Been guilty of both myself.
Sure,
I am guilty of diagnosing myself at times with small things, but I have never written myself a script. That's kind of frowned upon, and it's generally a no-no.
Sure, we take some liberties, but Todd is way past that. These aren't just Botox injections. They're invasive operations.
Huh. Let me have a chat with him. Check back with you.
Thanks.
It's impressive. I mean, not just the attention to detail, but the focus that must be required to achieve that.
Flattery. Really? You're the head of psychiatry. I figured you'd use something a little more clever to get inside my head.
Oh, come on. We're just having a little chat.
Okay, fine. I'll bite, but scrap the pats on the back. I know I'm good. You don't need to tell me.
You mind if I sit?
So patients often think that psychiatrists learn how to get inside people's heads. It's like we take a course on mental manipulation 101, but I can tell you, I never took that class in medical school or residency. What Dr. Charles was likely trying to do was find a way to connect with the patient to help him feel more comfortable during the interaction. As you can imagine, seeing a psychiatrist in an emergency setting is often very anxiety-provoking for most people.
Pull slowly and evenly.
I am.
No fragments?
No. All clean.
Okay. We can move on.
Did we just put our ungloved hand in our wound, right? Risk infection. And then on top of that, put our bloody finger in our hair? Gross.
Easy.
I'm controlling the bleeders.
No, you're frying healthy tissue.
I'm calling plastics, they'll finish up.
No, look, we're almost done. I don't have the energy to start over with someone new.
Then please let me do my job.
Rather you use absorbable sutures.
Can you grab 3O absorbable vicryl sutures off the cart?
Actually monocryl instead of vicryl.
We don't have that in the ED. I'd have to call OR, have them sent down.
I just want it done right.
Me too, but second guessing every move I make isn't gonna get us there.
Fine. Vicryl will do.
So when you compare suture types, monocryl has been found in head-to-head comparison studies to result in significantly smaller and less reactive scars. And it has a reduced tendency to produce hypertrophic scar formation.
Last one. Good. The nurse will dress the wound. That guy's impossible. I'll need the entire procedure.
No, he is challenging, I'll give you that.
And he's a doctor. If he's reckless with his own health, he could be reckless with patients. He shouldn't be practicing.
Hold on, are we seeing some countertransference here? So this is when a provider projects their own unresolved conflicts onto the patient. And Ethan's reaction is a tad strong, and him making the comment about the surgeon being reckless with his own health makes me wonder a little bit if there's something he himself is struggling with.
Except that people with BDD tend to be pretty rational. I mean, except when it comes to their own bodies. You know, and that tracks with Dr. Lowry. I mean, talking with him, it's clear that he just doesn't have the same issue with his patients as he does with himself.
Maybe the medical board should be the one to decide that.
No, I think I'm pretty qualified.
So now that the BDD diagnosis has been confirmed, let's talk about this a little more. BDD occurs in around 2%, or 1 out of 50 people, and occurs almost equally among males and females. And often, it has an age of onset in the teenage years. And common features seen in those with BDD include high levels of anxiety, social avoidance, depressed mood, neuroticism, perfectionism, and low self-esteem. This is where there's somewhat of a mismatch between the traits of a typical patient with BDD and the traits of the surgeon in this show.
What are you doing?
I don't like your wound aversion.
No, I closed all the dead space. It'll heal seamlessly.
The dimple, they need to be fixed.
Don't!
Get off of me.
Please, you're hurting yourself. Need some help in here.
This is all your fault. They're not perfect.
Stop.
Dr. Lowry.
Soft restraints.
No restraints, no restraints.
Get off of me!
He's 5 of Haldol.
Not yet.
He needs to be sedated.
Ethan! I'm gonna be the one who makes that call, okay? Let me handle this. Hey, Todd, look at me. Right here. What's going on, buddy? Breathe with me, all right? Into the nose. Look at me. Into the nose. Out the mouth.
So where I trained, we would call a code green in the emergency room if we had a patient who was escalating and we needed assistance. While using restraints and Haldol were sometimes done in severe cases where the patient was a direct harm to themselves or others, it really should be a last resort option and not a first. You want to use the least restrictive intervention when treating patients. And not to mention, right, you'll never de-escalate an escalated patient if you yourself are not regulated. So approaching the patient the way Ethan did only results in more chaos and also potentially more harm, right? So when trying to de-escalate someone, you want to use non-threatening body language, you want to maintain a calm tone to your voice, and you want to provide reassurance that you're trying to help. So Dr. Charles' approach was much more on par with what we would try to do clinically.
He's a lot calmer.
Don't you ever interfere with the treatment of my patient again.
Buddy, you're way out of line.
Me? The guy's ripping himself to shreds. I told you he needed to be on the hold. You shot that down, and here we are.
That's right. And locking him up still isn't the answer. Neither are restraints or sedatives.
How can you say that? He's harming himself. If you would have just helped me, we wouldn't be in this situation.
A psychiatric hold is when a patient is forced to stay at a hospital or psych facility so that their mental state can be evaluated further by the treatment team. And generally they last somewhere between 48 to 72 hours depending on the state you reside in. Obtaining a hold on a patient should also be a last resort option, and each state has their own criteria for what things can result in a patient being put on hold. So for example, in Iowa, where we follow Chapter 229 in the Iowa Code, there are 4 main criteria that we consider when evaluating whether or not to put someone on hold, right? So these include 1, the patient being a harm to themselves or others, okay? Number 2 is the patient inflicting serious emotional injury on family members or others who maybe lack reasonable opportunity to avoid contact with the patient. Number 3 is the patient being unable to satisfy their basic needs. So we're talking nourishment, clothing, essential medical care, or shelter. And then on top of that, the patient has the likelihood of this resulting in physical injury, debilitation, or death without treatment. And then lastly, number 4 is that the patient has a history of noncompliance with treatment, right? Which resulted in either emergency hospitalizations or acts and attempts that have caused serious physical injury to the patient themselves or to others. Another very strong reaction, right? This is not just about the patient. There's something more going on here that Ethan's struggling with internally. We don't commonly see physicians going around punching things in the hospital.
Yeah.
Hey. I just wanted to apologize for my behavior. I overreacted.
Apology accepted. Appreciate you coming down. What did you do to your hand?
Dr. Charles, always so observant.
Rough day.
Tell me about it. Right?
After I left your office this morning, there was a patient, Drew Corbett. He died. Acute respiratory failure. When Drew coded, the resident wanted to do compressions. But that's against protocol, so I held him back.
Okay.
I stood outside the treatment room and I watched Drew die. I wanted to pound on his chest. But I just stood there and I did nothing. Same as yesterday, same as it'll be tomorrow.
Man, I'm just so sorry you gotta go through that. You know, maybe the reason that you got so upset at Dr. Lowry is as simple as this. I mean, it's very easy to look at body dysmorphic disorder as physical, about the body, right? But it's actually a control issue, right? Not unlike feeling responsible for every patient's outcome, or wanting to keep an ED functioning perfectly in the middle of a pandemic.
Lives are at stake, Dr. Charles. I have to be effective at what I do.
But what if that's not always possible?
So what, I'm just supposed to give up? Accept failure?
No. Accept being mortal.
Dr. Charles for the win. He is so good at connecting the dots. And this is a great example of how our prior experiences of patient care can trigger certain emotional responses and behaviors that trickle into our present interactions. As doctors, we try to minimize these responses, but when it comes down to it, we're human and we need to remember to work on our own self-care. If you've enjoyed this video, make sure to hit that subscribe button and head on over to the next one to see another Psychiatrist Reacts.